Welcome to Pill Point, where today we'll break down antibiotics, their interactions, resistance, and the key counseling tips you need to know. Antibiotics save millions of lives every year. But have you ever wondered why doctors and pharmacists warn you about taking them with multivitamins? Or why some antibiotics seem stronger than others? Today, let's break down antibiotics in a simple, step-by-step way. Their interactions, bacterial resistance, and key counseling points every patient should know. First, why can't certain antibiotics be taken with multivitamins? Take doxycycline, a commonly prescribed antibiotic for acne or respiratory infections. If you swallow it together with a multivitamin that contains calcium, iron, magnesium, or zinc, something interesting happens. These minerals bind to the antibiotic inside the stomach, forming a complex that your body cannot absorb. So, instead of fighting the infection, the antibiotic gets wasted. That's why patients are usually told, take doxycycline at least 2 hours before or after multivitamins or dairy products. Other antibiotics with similar interactions include ciprofloxacin, a fluoroquinolone, levofloxacin. Both can be reduced in effectiveness if taken with mineral supplements or even milk. Now, let's talk about antibiotic strength. People often say, this antibiotic is strong, that one is weak. But what they're really noticing is bacterial resistance. Bacteria are smart. They can mutate, share resistance genes, and even pump antibiotics out of their cells. This makes some antibiotics less effective over time. For example, amoxicillin was once highly effective against many respiratory infections. But now, due to resistance, it may not work as well unless it's combined with clavulanic acid as in Augmentin. On the other hand, antibiotics like carbapenems are considered very strong, not because they're magically powerful, but because resistance to them is still relatively low. So, it's not really about strong or weak medicine, it's about whether the bacteria are resistant or not. Finally, the most important part, counseling patients on antibiotics. 1. Complete the full course, even if you feel better in 2 days. Stopping early allows surviving bacteria to regrow and potentially become resistant. 2. Timing matters. Some antibiotics need to be taken on an empty stomach, others with food. Always follow the label or pharmacist's advice. 3. Avoid alcohol with certain antibiotics. For example, metronidazole and alcohol can cause nausea, vomiting, and flushing. 4. Look out for interactions. As we discussed, vitamins, minerals, and dairy products can interfere with drugs like doxycycline and ciprofloxacin. 5. Report side effects, such as diarrhea, rashes, or yeast infections. These may need attention. So, remember, antibiotics are powerful tools, but only when used correctly. Watch out for interactions, understand resistance, and always follow your pharmacist's counseling. Thanks for watching. If you found this helpful, like, share, and subscribe for more health and medication tips. Drop your questions in the comments. See you in the next video, and stay healthy.